factors that influence your having a memory problem?
Usually when men like you are screaming at me or grilling me, or someone like Travis doing the same.
You weren't going to put up with that either, were you?
Put up with what?
Well, what is it that we're talking about here?
Which part put up with?
Were you going to put up with what we just talked about? Are you having problems understanding again what's going on?
Sometimes, because you go in circles.
Yes or no?
I was saying no when you interrupted me. That's not what I said. Am I allowed to tell you what I'm trying to say?
If I passed a lie detector test, would that help you?
Could help you.
You're so weird anyway.
It is time for our Behavior Bureau. Back with my co-host this week, psychologist Michelle Ward. And Michelle, I really want to pick up with that question you left me off with, which was, how do I manage patients like Jodi? And look at the prosecutor trying to deal with her slipperiness. So they're slippery, and then poor Dr. Samuels found out how sort of porous they are, can suck you into things. I want to talk about that. She seems to find fault with others, but then kind of works them in interesting ways. You agree with me?
Well, absolutely. And when I look at that tape, I want to scream, who the heck do you think you are, girl? But then I have to remember, this is so typical. This self-love, this narcissism, and then highly critical of everyone else. This is how she got away with convincing herself it was okay to kill Travis. He had it coming, like you've said before.
He had it coming.
And I'm
That's
justified.
Right. And I'm in denial that something bad could happen to me because of it, because of all that thinking about how justified she was in the behavior.
And important. She's important.
Joining us to discuss this, psychologist Judy Ho, also Patty Wood. She's the author of Snap, Making the Most of First Impressions. Forensic psychologist Cheryl Arrett is still with us. So, Cheryl, here's this woman. She killed her ex-boyfriend, and yet she's still sitting in judgment of others. Do you agree with Michelle?
I totally agree with Michelle. I think that she can sit back and kind of point out all these things that other people are doing. It's like, hello, look what you just did. And it's kind of like gaslighting. You know that movie where it's an old movie, but the guy tries to make the girl think she's crazy by denying her reality? This is what Jodi does with people. If she acts like things are totally normal and no big deal that she's doing, you're supposed to go along with it. But she likes to focus on other things that people are doing to throw them off base.
Yeah. Michelle, you guys, you know what I want to do? I want to start compiling a list of the sort of strategies that somebody like Jodi uses so people can start to understand this. People keep asking, how was this possible? But slipperiness, gaslighting, Patty, you want to add to that list?
Yes, she takes great delight in this. That duper's delight, that little grin on her face that I think is really going to hone in for the jury. She enjoys the process. Now, Martinez does a really good job with that back and forth body language of wearing her down so she can't perform. You notice that behaviors for most of her testimony was, here's the question, let me answer it to the jury. Here's the question, turning away. He draws her in. So she had to attack. That was her technique this time. She had to attack him.
Interesting. And Judy, thank you for joining us on our panel here. You get what I'm talking about here in terms of how my nurse, again, I'm talking about me going to a room with a patient like Jodi. My nurse would always say, they're like an octopus. They'll come out and they'll get you and they suck you in. Help people understand what that is.
Well, Dr. Drew, it's exactly what she's doing. She's sucking everybody in and just having them play into her little games. I mean, here we see Jodi just denying the things that are the worst about herself and putting them on everybody else. And she seems very comfortable with that, but that is absolutely a well thought out, preconceived strategy that she's using. But she is getting frustrated and she is getting a little bit floundered because that's why there's so much rage in the way that she's kind of coming back at the prosecutor. Because she is so shaken by it.
Okay, and the rage, and then we got tears, sobbing during the police interrogation, sobbing on the stand. I think we have some footage of this, control room. Can we, yes, let's watch this.
Ma'am, were you crying when you were shooting him?
I don't remember.
Were you crying when you were stabbing him?
I don't remember.
How about when you cut his throat? Were you crying then?
I don't know.
You're the one that did this, right?
Yes.
I think you're feeling the reality in the moment now.
No, I'm just feeling all of the things that I'm going to potentially miss out on. And my dad is not doing well. He doesn't think he has very long to live. My grandparents aren't getting any younger, and I just have an awesome family.
Jodi.
I actually think that was a genuine question from Martinez, which is, what are you crying about? You're the one that did these horrible things, right? Judy, pick it up there.
Well, she is deflecting like crazy, Dr. Drew.
Right.
She is just putting it back because once the attention is on her, never mind the fact that she murdered somebody, all of a sudden it's, oh my goodness, poor me, I'm the victim. Now I'm going to lose out on this fun time that I could be having with my family, and they're not feeling well and they're aging, and oh no. And she's just really pulling at the heartstrings and trying to create the smoke screen right now.
Right, it's it. What gaslighting, as Cheryl said. And
right.
Patty, does the language bear that up, the body language?
Absolutely. Babies start fake crying about 8 months, and Jodi continues to use fake tears. Real tears, your eyebrows go up, there's a pouting of your lips, and you notice the sound. The words are very logical, and when you're really crying, your neocortex is not involved in the process. You can't speak logically like that. So there's a real disconnect from the tears, the fake tears, and what she's saying as well that signify that they're fake.
Michelle, put a little button on that for me, will you?
Well, you know what? People study, people like Jodi have this saying that a psychopath or somebody like Jodi without a conscience, they can learn the words of an emotion, but they never learn the music of an emotion. And that's what Patty's kind of saying. She knows what to say, she knows what to do, but she does not really feel it.
Next up, is the defense vilifying Travis for his troubled childhood? Our behavioral bureau is on that case, and later, the Travis that those who knew and loved him want you to know and see, a video you will only see tonight on Dr. Drew on Call.
Jodi's up there talking about her background, but Travis isn't here to talk about his, and his was 10 times worse than anything she could ever try to even make up. You know, he was really the victim of being born into a broken family. His mom was a drug user, aggressively. He was homeless with her at times. I remember he was telling me one of his memories was living underneath a actual cover on a truck port in the backyard somewhere, and actually having visions of his mom literally going to the bathroom in a 5-gallon bucket. And so this is where he came from, to go through all of that, deal with those struggles, deal with that baggage, and to decide to make something of himself rather than use it as an excuse.
There you go. That is a friend of Travis Alexander bringing to life for us the difficult childhood that Travis went through. And in fact, he went on to talk about his admiration for Travis and what he'd been able to overcome and what he was becoming in his life. Back with my co-host, psychologist Michelle Ward, and our Behavior Bureau. Cheryl, will vilifying Travis for his difficult childhood, and let me frame this. If you remember, the defense painted a picture of someone with a childhood. Of course, they painted Travis's childhood. Doing that, does that work for the defense, or is that going to backfire?
I think it's going to backfire, Dr. Drew. I think Travis did such a great job of making choices that were different and choosing a different kind of life. You know, and when I hear the defense expert talk about how if your parents were drug users, then you're more likely to be a violent abuser. Well, that's only if you become a drug user too, isn't it? I mean, what do you think about that?
Well, I think, and I'm going to bring Judy into this part of the discussion, I think, and put the whole panel up there for me, and you'll probably all be nodding your head at this. Yeah, you could become a victimizer, or you could become the victim. Or you could go back and forth between the two roles. But I would say, hey, this guy's probably, judging them by the way he's so caring about people and so involved, this guy's more of a codependent. He's more like the guy that's going to get sucked in by the octopus. Judy, you agree?
Yeah, absolutely, Dr. Drew. And, you know, the thing is, he did grow up in chaos, and we know that some people can get out of that and make changes as adults, but there's a subconscious part of himself that probably is still a little bit attracted to chaos, maybe thinks he's not quite good enough for a stable life, and there might be some self-sabotage going on. And I think because he had this relationship with Jodi, she kind of represents some of that chaos, don't you think?
Absolutely. And men that have emotional abuse are more likely to get sexual compulsion and sucked into sexual addiction even. I'm not saying he was a sex addict. We've never established that. But that may have what set him up, predisposed for these kinds of predispositions. Patty, what are your thoughts?
Every time you see a photo of him and he has that wonderful smile and he's always going forward, it shows his actual confidence and his joy in life. And I think that particular image is reaching us as the audience.
Yes, thankfully, because there's so much vilification of Travis in the courtroom. Michelle, let's finish this panel up. What do you got?
Well, I agree with you, Dr. Drew, and I think that, Travis's story is a story of redemption and second chances. And you could see how he's likely to give somebody a second chance like Jodi, even though she's been misbehaving so badly. He really believes in people and wants them to be the best they can be, and I think that's might have been why he was in this mess.
Yes, but there is a warning here, all of you. You guys will all agree with me that our real liabilities come out in our interpersonal lives. We could be doing great everywhere else, but our liabilities are in our interpersonal lives, and that's what Jodi was preying on. You guys agree?
Absolutely.
The mess is going to be somewhere.
Yes.
Right.
That's right. There you go. There you go. Thank you. A great panel. Next, Travis on tape. We're going to show you the